how we can take care of this by doing this methods.
No, we are definitely, we have interfered with nature for a long time. The day we came out of the cave, we started interfering with nature. Everything what we are doing today is, but I am totally agreeing with you that this is the most advanced interference with nature. But then, I'm not propagating it. I'm saying the scenario as it appears today. As we had the beautiful presentation, I mean, and the most advanced country, Japan, says 47% of the Japanese don't have sex. They don't have the time or the inclination of what are we looking at? This is not a dream situation. This is a real life situation. And if that's going to be in Japan, I'm sure most countries are progressing towards that. So I'm only giving a scenario because if you say what I told you before, sex is for reproduction, no longer sex is required for reproduction. And couples are living apart. So this is a real life scenario. I'm just posing a scenario where it could happen in reality in 2050. I may not be around to see that, but that's what it is. I'm not suggesting, I'm not recommending it, but that's the reality.
See, imbalance in the society of the ratio of the man and a woman has created a lot of social problems, yes, which I have personally seen in Philippines. The ratio of women to men is 5:1, because most of the men have left the country to earn money. Now these women are left alone. So they try to cling to someone, a boyfriend or who or whatever possible, and most of them are unmarried mothers. So they have a lot of responsibility to earn for themselves, for the child. And it has created a lot of social trauma to the women.
Yeah, I agree with 100%
so
with you.
Everything finally comes back to the women.
Yes.
Because finally she is going to be a mother. She cannot leave the child. So similar way, when these techniques are applied, it would really disturb the women.
It will definitely. There's a huge demographic problem. There's no doubt at all. In fact, as they were raising, the fertility rate is going down in many countries, Japan, Singapore, and many European countries. And in fact, they're encouraging people to go on dating. They're giving the Valentine's Day holidays, but still the rate seems to be not even the replacement rate. In fact, they need people from outside to come and work for them. That's a huge problem. That is to be addressed by the sociologists. All I'm trying to tell you is that technology is advancing so fast, then this is a problem which we have to face and which we have to address. But I'm not giving a solution to it because there's no easy solution to this. These men have to go out because they need a job to keep care of the families. So this is a real life situation. So.
That was a real excellent talk, Dr. Pandyan. I am a gynecologist and an IVF consultant.
Wonderful.
And in the capacity of Foxy Sexual Medicine Committee chairperson, I'm here. Well, sex and pregnancy, or sex and reproduction is definitely, there is a correlation, there's no doubt about it. But what I'm trying to say is that we all should realize, the non-IVF people or the other faculty people, that there is a lot of indication for treatment for when the woman doesn't get pregnant, which is absolutely indicated. And we see a lot of these couples, now having low sperm count, and the women with a low ovarian reserve. So unless these women are helped with ART, and ART is a real boon. Assisted reproductive technique in the form of IVF or ICSI is a real boon when it is indicated. It is definitely not a replacement. I'm not telling it's a replacement, but definitely it is a boon where it is absolutely indicated. And there are lots and lots, and it is on the rise for various reasons. Definitely to have sex around the fertile period is what most of the couples think they should, which it should not. It's not the right thing. But that is what you rightly said is the current scenario, and it's the reality. That's what they think. They have a lot of apps to know when they're fertile. They use urine sticks to know where the LH surge happens, and they type the relations according to that. And that's not what I'm propagating, but that is what is the reality. Yeah. And but what I would just like to emphasize is that ART and all designer babies is one aspect, but just the pregnancy per se, and especially in men with a low sperm count, women with low ovarian reserve, endometriosis, fibroids, blocked fallopian tubes, this is absolutely an indication where you cannot just tell you go and keep on having sex and you'll get pregnant. So that's not what the answer for the couple who wants to have children. So that's a reality. And PGS and PGD, that is pre-genetic diagnosis, has definitely helped couples who have thalassemia and sex-linked disorders. So you select an embryo which is not affected with thalassemia or a sex-linked disorder, you know. So these like Duchenne syndrome and also you can actually eliminate thalassemia is what I would like to contribute. Thank you very much.